This artery over here is the aorta, the biggest artery. It leaves the heart superiorly over here. Hypertension, that is, an increase of blood pressure, can damage this artery. And when it's damaged under hypertension, it is prone to development of atherosclerotic changes. It is not rare that atherosclerosis almost completely closes the aorta. And if atherosclerosis and hypertension can do that to a large artery such as aorta, imagine what it can do to smaller arteries. Smaller arteries supply brain with fresh oxygenated blood. They also supply the human heart with fresh oxygenated blood. Now, it is not surprising that hypertension is associated with dangerous, lethal, and deadly outcomes such as heart failure, stroke, and heart attack. We mostly don't know what causes hypertension, but there are good ways to treat it. And despite having different types of medication to treat hypertension, sometimes we simply cannot get that blood pressure under control. In such cases, it is extremely important to properly and completely perform diagnostics and search for an underlying condition that is causing all the trouble. And as I said, the cause of hypertension is usually not known, but in some cases, especially when oral medication fails, it could be that some dangerous underlying condition indeed is the cause of hypertension. As if all the stress and suffering wasn't enough, as if this single diagnosis of hypertension wasn't enough. Sadly, that can be the case, and a skilled doctor is supposed to ask about specific symptoms such as muscle weakness or reduced agility and obstipation. Now, before I explain why specifically these symptoms in combination with hypertension, I have to ask you something. You see, YouTube and other websites, they suggest videos based on likes and subscriptions. So to help me reach more people who suffer from hypertension, please like and subscribe. Like, you can do it now. Only if you want to. But now back to these symptoms. Why specifically these symptoms? Well, because when they appear in combination with hypertension, they indicate a presence of a condition called the Conn's syndrome. This is a condition in which adrenal glands right above kidneys produce too much aldosterone. Now, aldosterone is a hormone which causes sodium and water retention in the kidneys. And because of all this sodium and water, the volume of blood is simply larger, and it causes an increase of blood pressure. And because of this increase of blood pressure, patients can suffer from a heart attack or a stroke or a heart failure. All of these conditions are dangerous and deadly. However, a skilled doctor should be able to recognize this condition early on, and patients should receive an appropriate therapy. There are great ways to diagnose this condition, and there are more indications that it might be present. There are also great ways to treat it. Both of you, doctors and patients, we have something for you. If you're a doctor and you want to make videos like these, then go to anatomsky.com. But if you're a patient and you have more questions about hypertension, then go to symptomsky.com/help/hypertension.